Um, Welcome everyone. I'm Marilyn Howarth, and this is our very first seminar where we are highlighting our translational pilot projects. We have two really great projects to tell you about today, and I was excited about them when we awarded them, and I'm even more excited about them now that they're nearing completion and really have done such great work. So I'm sure you'll see why I'm excited shortly. The one I'd like to start with is with Lorna Rosenberg. Lorna is the director of the Southeast Pennsylvania branch of Women for a Healthy Environment. And I'm going to ask Lorna if she would introduce the rest of her team, because I know she'll be joined by at least one, if not two, I think, two other presenters. Go ahead, Lorna.
Thank you, Marilyn. It's a pleasure to be with all of you today, and I am really excited to introduce you to our excellent team. The two researchers with us on this project are Randy Prasad. Randy, you want to give a wave? Randy is our research assistant, and he's been excellent at pulling a lot of the data together and doing a lot of other things that he'll inform you about when we go over the details of the study. But he's currently a graduate student of Master of Public Health student at Drexel, about to graduate soon in March, which is very exciting. And he's been super and helped to put this program together. So Randy is with us. And also we have Chanel Palmer, who I believe also is on the call. Chanel, there she is. Hi, Chanel. She is a student in the rapid nursing program at Temple University. And she has been our communications and outreach person for this grant and study. Okay, this study is a translational pilots project. It's called the Investigation of Shade Structures in Encouraging More Outdoor Play in the Summer in Urban Childcare. And next slide, please. We have a grant. Our organization, Women for Healthy Environment, has a grant from the U.S. Environmental Protection Agency to work with healthy childcare in Philadelphia since 2021. And this project kind of grew out of our work with childcare as we have visited the various centers in 4 environmental justice neighborhoods in North Philly, Hunting Park, also Strawberry Mansion, Cobbs Creek, and Point Breeze in West and Southwest Philly. So these areas have childcare, and childcare means both center-based and also home-based. Center-based is 6 and above, and up to 6 can be family-based childcare. And in our going out to the various centers and talking to them about environmental health issues with children and their facilities, we made an observation. And those observations had to do with the lack of shade, particularly in summertime. So that was somewhat of the impetus for this project. And I've covered some of that already. In our grant with the EPA, we have numerous other colleagues and partners that we've worked with. So Philadelphia's Office of Sustainability, and we have First Up and a lot of the other nonprofit organizations that work with health in childcare in Philadelphia. And also the health department has been a partner of ours, actually, for another study that we did. So there was a report, our work with the EPA and its foundation for our grant, part of it was this Beat the Heat report, which came out from the Office of Sustainability in 2019. And it talked about the unequal extreme temperatures in Philadelphia, particularly in environmental justice neighborhoods, due to lack of tree cover, due to the density of housing and the surface cover for asphalt and many other reasons. And then, who lives in those neighborhoods had to do with redlining and other issues, political and sociologic issues, as to why folks are where they are. And so a lot of this work focuses on a public health concern, but also, as I mentioned, with racial and social equity. So our objective was to determine that if we give shade structures out to childcare, will that increase the outdoor playtime for kids? And the result is that we found out that decreased surface temperatures is inversely proportional to outdoor play. So the reduced temperature level creates an opportunity for indoor play, which is, of course, critical for children. Randy, you're going to cover this part, right?
Chanel.
Yes, this is my part. So this is the project aims. We had 4 objectives for this project. One of them was just determining the heat that was contributing to childcare play in vulnerable neighborhoods. So seeing if the heat is a reason why people were not going out to play more, or we're probably coming in earlier. A second objective was just collecting the amount of time that staff and children were outside with and without the shade, to see if it increased or decreased, to see how the shade structure affected their I guess the longevity of their playtime. And the third one was the surface temperature. So in the shade versus direct sun in the Philly neighborhoods, depending on where you live, there will be more trees and more structures to help with the heat. And depending on that neighborhood, we were able to see if it made a difference, which it did, in my opinion, and also what the facts represent. And then the fourth one is just providing educational training on air quality and impacts on outdoor play.
Do you want to?
So as I mentioned, the inspiration for this came from our travels in these neighborhoods and what we observed. And it started out with this Beat the Heat report that was from the City Office of Sustainability that really targeted Hunting Park as a neighborhood, but it lapsed over into the other neighborhoods as well. And our observation, as I mentioned, that the lack of shade, whether it's from tree cover or canopies or anything else, was lacking in these areas. Sometimes you have children outside with no shade at all, completely exposed to the sun. They're playing in what we in Philadelphia call a driveway or an alleyway. I think if you're from New York, it's an alleyway. But there's no shade whatsoever where the children are. And these are little tiny kids. These are 6 years old and under. So they really do need to have protection from sun radiation. And then the importance of actually educating childcare about the air quality index for safe outdoor play. So especially last summer, we had incidences where there were fires from Canada that caused a lot of air pollution here in the Philadelphia area, particulate pollution. And it was really unsafe. The air quality index is a measure of the air pollution in a particular region based on a lot of different factors that gets rolled in and averaged out, and then pops up with a color of and numbers that go with it of a relative scale of green for good, yellow for caution, orange for slight hazard, red for real hazard, and purple for, oh my goodness, we better find somewhere else to be. And when the Canadian fires happened last summer, we were in the red and purple levels, which, I used to work at the Environmental Protection Agency. We never thought we'd see that here in the Mid-Atlantic, and it was frightening. So educating childcare about when it's safe for children to come out and play, and particularly those that have respiratory ailments or asthma, for staff and for kids, to have them understand that if it's an air quality day that's a problem, they need to keep the children inside and safe, and put on air purifiers to keep everybody's particulate levels down. And that's really important. So the education piece not only included a shade structure for the childcare centers and a thermometer, but they also got air flags, and we're hoping that they'll have an educational program with their childcare coming in the spring and the summer, when the air quality will change a lot more than it does in the winter.
So the overall results that we did find was that there was a surface temperature decrease and there was an increase in playtime across all participating centers. So in terms of what the averages we found was there was an average of 14.2-minute playtime increase and about a 6 degrees temperature reduction in the surfaces. But it is really important for me to say this, that the point of the study was not to compare any one of the centers to each other. Each center is independent of all other factors, but looking at the data, these were the averages we did find. And then in lieu of time, I won't speak about all eight childcare providers or centers, but I will talk more in depth with this one, and then I'll click through the others. So this participant is from Hunting Park, and they're coded HP1. If you look at the graph on the left-hand side, this graph specifically speaks about the surface temperature recordings and the shade structure. So the red line represents the days with no shade, the temperature days with no shade, and then the blue is with shade. So first off, why is there no blue line here? Is the point of our study was we wanted 1 week being a quote unquote baseline. So they didn't have the shade structures. We wanted to see what the surface temperature was and how often the kids were outside or how long did they play. And then with the blue line here was the introduction of the shade structures. The averages that we did find was that an average temperature with no shade was about 96 degrees surface temperature. With the shade was about 87.55 degrees, and the temperature difference was about 9 degrees difference. Now, if you look over to the right-hand side, to the other graph, this is dealing specifically with average playtime and the introduction of shade or no shade. So with no shade, this participant specifically had about a 45-minute playtime for the children. And then with the introduction of shade, they had about a 52-minute playtime. And then I'll just click through here and you'll see a similar pattern as we go through. And then this is more of a unique one for this graph, because why is there no increase is certain centers also have very rigid or very strict playtime. So that couldn't be a factor that we could change. And that was something that we had to know with this community.
Randy, can I jump in for 1 second on the chart that showed that there was little change? The thing that's interesting and notable here is what we would recommend, and I know that Marilyn was involved with us in a webinar that we did about this issue regarding heat, is that the fact that somebody doesn't adjust the playtime based on the heat index or the air quality when the temperatures are really strong outside is a challenge, because we ask them when they learn about the air quality index to make adjustments in this schedule so that they can optimize the amount of time that children will be outside, but also be outside when it's the safest. So if they go out every day from 11:30 to 12:30 and then have lunch, and that's a time when the heat is the hottest and the air quality is the poorest, we would recommend to them that they change their playtime and go either earlier in the morning or later in the day when it's safer, and that they not be as rigid, because we're really concerned about health of the children and the staff. So let me just throw that in there to think about. Go ahead, Randy. Sorry, thanks.
Okay. So Lorna, you can take the challenge slide.
Okay. In challenges, there was a bit of a challenge with a daily log sheets that we had for providers. We had that electronically each day. The providers that were really collecting the data for the study, they had a daily log sheet to fill out. Wasn't very involved. It required them doing the temperatures and recording them and making a note of the air quality index so that we could see what any variability was in the play times based on that. And you know, they weren't 100% as consistent as we would have liked, and they didn't all do it at the same hour of the day either. So that was some variability there. And then, so the number of observation days again varied between different providers, but we really didn't compare one to the other. Each one was unique. So it was a little bit of a challenge, but didn't really throw us off very much. And we needed to also control factors like the time of day and temperature measurements that could be considered in the future studies to be a bit more consistent. Again, we were not the ones running around to all the centers to do these measurements. They were doing it, so they somewhat did it at their own convenience. I guess, for the future, we could certainly focus on having at times more set to keep that convenient for them. Do you want me to do the successes, Randy, or you want to do those? You're going to do this.
So the successes that we did have going off of the challenges we had, the most important one was communication, because the most important thing was we were actually able to speak to the childcare providers every single day. And that helped us overcome our initial barriers. And those were from trainings, the daily form, the follow-ups, and the post-study interview. So the training taught the childcare providers how to collect the data and send the data to us every day using that daily form. The follow-ups were either us visiting or giving them a phone call during the study. And the post-study interview is something that Chanel did, which she'll speak about in the next slide. The other successes that we had was actually doing a community-based research project. So this allowed the actual childcare providers to take initiative when it came down to this project, adding to the research gap, because as you do a literature review for this type of work, there is a niche for this project, and there's not a lot of work done already. And the last thing is the AQI daily check integration. So it was really important for us to provide this education on what AQI even was. But this project allowed the childcare providers to have to go on airnow.gov every single day, check what the number of the AQI was and the color, and send that to us. And the last thing was the distribution of the air quality kits that we created, which included documents that we created, documents collected from the EPA, and the air flags as well.
Hi, everyone. So in our follow-up interview, I was able to talk to the participants about how, the shade structures impacted the childcare center and even the playtime. So a lot of them felt like it did extend the playtime in some ways, but a lot of people stuck to their schedules just because they had a schedule to follow due to it being a daycare. And some people did comment and say that the kids enjoyed being outside longer, and there was noticeable comments about the shade structures. They got fewer complaints about the heat, and they were able to play in more of the area. So the grassy areas are typically cooler than concrete areas. So placing those shade structures on the concrete areas of the daycare areas helped the children be able to utilize that space. And they felt like the shade structures were easy to put up and put down, seeing as winter is now here.
So the pilot report is done and looks great, we think. The other thing is that what our next steps are to prepare a mini report. So each child care center will get the chart and the bar chart and the other chart, the line chart with the data that they collected from their center. Other thing, Marilyn, all of you have given us, based on the fact that we already now know that there is great benefit from having shade structures, we ordered 30 more structures to work with the child care centers that are in our Healthy Childcare Champions program. So these are child care providers in Philadelphia in these environmental justice neighborhoods. Though beyond those that were in the test study, there are other partners that we work with that could benefit from having these structures. So we've purchased 30 of the 29 structures, and we've offered them to the child care centers that are in our Healthy Child Care Champions program. And we have about 15 who've responded like immediately that said, yes, we want the shade structures. They are going to each get a shade structure and an air quality index kit. And we're looking forward to having a webinar with them to be able to train them on how to use the air quality kit. They also will get a thermometer, and if they want to keep up some data collection so that we can get more information and keep it as a part of this, like an extension of this study, we think that'll be valuable because of climate change and heat moving forward.
Great, thank you so much. What a great presentation and what a great project. So we've done some real good for lots of childcare centers, and you have a plan to continue that for more. So that's really terrific. I wanted to move on to the second of our pilot projects so that they have enough time. This will be presented by two presenters. First, we'll hear from Deetra Connor, the program administrator of the Tabitha Corps in Chester. And then we'll hear from Courtney Walk, who's the associate professor and associate director of the Penn Center for Mental Health and an implementation scientist who really worked on the data analysis having to do with the project. But Deetra, let me just turn it over to you. Thanks so much for being here.
Hello, everyone. I'll be presenting the PowerPoint on behalf of the Chester Cleanup Pilot. Chester Environmental Partnership Neighborhood Cleanup. To accomplish this cleanup, they partnered with Tabitha Corps Chester, which is a youth workforce development program. We focus on ages 17 to 25, and we give them something to do positive during the summertime, and we give them workforce development training in the process. The inspiration behind this project was that we wanted to collaborate with the University of Pennsylvania and the work that they were already doing in the city of Chester with the Chester Community Asthma Prevention Program, which has identified the accumulation of trash and debris on local dumping sites as being triggers for children and seniors in their communities. The purpose of these cleanups were to reduce the asthma triggers, to improve and enhance the quality of life for the residents, particularly seniors, children, and the immune compromised. We also wanted to foster a greater awareness in the community regarding asthma, its triggers, and the negative impact of dumping. Our primary communication tool was a flyer that was distributed throughout the community 1 week prior to the cleanups occurring. And this is an example of this. This example of the correspondence shows that we gave all the information of the participating parties and that residents were able to call in if they needed assistance. And this was the correspondence that was distributed throughout the community. This was very helpful. It gave residents the opportunity to ask us questions in person and to see our faces prior to us coming out to clean up, so that they would know who was in their community and what we were doing and why we were cleaning their neighborhoods. And seniors were also able to meet us and also get the information that they needed to call in for assistance of trash removal from their residents. These are the 12 cleanup sites that we utilize in our cleanup. Our cleanup occurred over a 12-week period. 8 of them took place on the west end of the city, and 4 of them took place on the east end of the city. Each cleanup was done for 2 days out of the week, every Thursday and Friday. The dumpsters were removed on Monday to give residents time to utilize them over the weekend. The awesome thing was that every dumpster was full to the brim and sometimes overflowing. So that was wonderful that everybody utilized them. And sometimes we had to get an additional dumpster to accommodate all the need in that community. Now I will share the pictures of each cleanup site. This is our first cleanup site. This was the 7th through 8th block of Lincoln Street. This was a very successful cleanup. Many of the residents came out to support us in this endeavor. In the bottom right picture, one of the residents who came out and helped us clean up, he was a senior and kind of struggling, but he wanted to try to do his part. So it was definitely building buy-in within the community. And this is the 8th block of Lincoln Street. The second cleanup site occurred on Sunnyside Avenue and Madison Street. This also was a great cleanup. During this cleanup, we had police protection that came out to support us The residents were grateful and appreciative. We were able to help numerous seniors, and the residents brought us ice cold water. And if people blocked in the way in the area where we were cleaning and created an obstacle for us to clean, the neighbors would knock on the door and ask them to remove their vehicles so that we can clean successfully. And things went well. This is our third cleanup site, which is the 13th to 14th block of Pearland and Parker Street. In this cleanup, we were able to assist numerous seniors. And as you can see, the truck that is illustrated in the center, that was just one load for one senior's house. So sometimes we had to go back a second time to remove debris and trash that they had accumulated over the years in their house. And many of them did express to us that they had asthma. This is our fourth cleanup. This occurred on 8th and McDowell Street. This was also a successful cleanup. The residents came out to support us and helped us. They brought us ice cold waters and Gatorades. They took pictures with us, and many of them tried to help us navigate through the neighborhood to let us know areas that were unsafe. One resident who was featured down on the right, he brought it to our attention that some of the areas that had accumulated a lot of dump that was a dump site and had accumulated a lot of waste was due to the fact that there were giant beehives there. So when we went to clean it, he advised us to clean it as best as possible, but not to get too close. And we were able to see those nuisance beehives. So we did the best that we could do. In the 2600 block of Colhane and Kane Street, this was also a successful cleanup. Many of the residents did come out and support us. And we were also able to clean up a park that had been dumped on. It was directly in that location. And it was rewarding for the youth to see that after we cleaned it up, and many of the children in the neighborhood, in fact, did come out and play there. So, and there was a lot of drug paraphernalia and debris around in the play area that we cleaned up. And our sixth cleanup, which occurred on 2nd and Edward Street, this was also helpful to the community. They were thankful and appreciative. In this cleanup site, we learned that a lot of the debris that was on the ground in the fields was due to the fact that there were a lot of beehives that were below ground in that area. So we had to be cautious of that. Our fourth cleanup site occurred on 4th and Jeffrey Street. We were able, our seventh cleanup, thank you, Dr. Strand. Our seventh cleanup occurred on 4th and Jeffrey Street, and it was also successful. The residents did come out. We also had some residents come out with their lawnmowers and weed whackers and assist us while we were cleaning up. And a lot of the seniors drove their vehicles over, and the youth were able to unload the trash and debris that they had collected. This lady in particular, she had severe asthma, and she was telling us how grateful and appreciative she was for what we were doing. And she wanted to come out and help us, but she said that because of her condition, she was not able to do that, but she thanked us, and she was really touched by our cleanup efforts. Our eighth cleanup occurred on 21st and Edgemont Avenue. This is one of the dirtiest areas in our city. The residents were very thankful and appreciative. Some came out and helped us. They brought us carts to help us wheel things to the dumpster. But also we did experience some opposition from local drug dealers. They, at one instance, released some pit bulls on us, but thankfully no one was hurt. We learned that a lot of times they hide their drugs in potato chip bags and things like that that sit along the side of the street. So when we were cleaning, and also in the debris. So the first day they were really kind for us cleaning, but the second day they let us know that they didn't want us in their neighborhood anymore. So we kind of had to work around that, but it still was a successful cleanup. The neighbors were thankful and appreciative. The young lady featured in the bottom, she thanks us, and she also helped us, and the young man as well. She said that she was very depressed because of all the trash and debris in her neighborhood, and she felt overwhelmed that no one really cared to clean it up. So she thanked us for what we were doing. Our ninth cleanup occurred on the 500 East 8th Street in Chester. The part that was unique about this was there was a biker club directly across from the cleanup site. So at first they were kind of like wondering what we were doing in the neighborhood, but once they found out what we were doing by looking at the fires and them talking to us, they helped us with our cleanup and said that they were going to do a better job of trying to keep things clear. They also moved vehicles and cars and things that were in their way out of their way to make sure we could successfully navigate in their neighborhood. I'm sorry, okay. Our 10th cleanup occurred on 2nd and Ellsworth Street. This was also a successful cleanup. The neighbors were appreciative, and what you can see is right directly behind that playground is a shelter for displaced families and women who have experienced domestic child abuse. And the park that is there around that dump site is where most of the children play. So they were very thankful and appreciative that we had cleaned up that area for them. Our 11th cleanup occurred on the 200 block of Rainey Street. And what you can't see in this picture is that this is directly up the street from a shelter for underage youth who are pregnant and also have children. So they were thankful and appreciative for us cleaning in this area. So the residents were also thankful and appreciative and showed kindness by giving us water and things like that. Our final cleanup took place on the 800 block of Mary Street. The residents were also thankful and appreciative for us doing this, and it was a successful cleanup. What I'm now going to show you is the warm-up pictures after we cleaned everything up. So this is Lincoln Street, 7th to 8th block, and as you can see, the residents kept the area clean. There is little to no debris on the ground, and they made sure that people did not dump in their community. And one more thing for that dump site, for the Lincoln Street, when we were cleaning, the second day that we came out, some people had dumped other things down on the ground after we had cleaned up, and the city was kind enough to send an excavator out to support us in the endeavors to get some of the large debris that we were not able to lift to put in the dumpster for us. So the community began to support us in our endeavors. This is our second cleanup, Sunnyside Avenue and Madison Street. Once again, they kept the area clean. You see metal chairs and a little few things alongside of the fence. That's because the gentlemen in the neighborhood sit there in the evening underneath the tree and talk and socialize with one another. But for the most part, they kept the area clean. Also, during this cleanup, one of the residents who was a community captain who kept the neighborhood clean and tried to prevent people from dumping in this area, she was really grateful and appreciative for us cleaning it. She said this was the first year that she was not able to do it because of back surgery, and she was unable to get everyone to organize and support her. So when we did it, she came out, she was crying. She said it really had touched her heart, and she thanked us. This is the 13th through 14th block of Crellin Street. They pretty much kept this area clean. There is one area where they did dump again, and that's close to a park that is back there, but the residents kept them from dumping along their yards. This is 8th and McDonald Street. This is the cleanup where there were lots of bees. The residents kept this area clean, with the exception of one mattress that's on the ground. This is the 2600 block of Culhane and Kane Street. The residents also kept people from dumping back there and kept this area clean as well. This is 2nd and Edward Street. The residents kept this area clean. There's little to no debris on the ground, and it looks like the soccer stadium start taking advantage of the area being clean because they hung some banners up there to invite people to park there now, to let them know it's a safe and a clean environment. This is our 4th and Jeffrey. The residents, I believe, did a wonderful job keeping this area clean. I only saw one piece of debris, which is featured in the top left picture, but for the most part, they did not allow people to dump on there and they kept the area clean. So we're definitely building buy-in. This is the area that we had the challenges with, 21st and Edgemont. They did immediately dump there, but to my understanding, there's a reason, because they do hide a lot of drug paraphernalia and things in this area. This is the 500 East 8th Street area where the biker club is. They did keep their word for keeping the area clean in regards to not having large things dumped, but there is a lot of debris and trash on the ground, I would assume, from them gathering, and one tire was pushed in underneath the tree. This is 2nd and Ellsworth Street, and for the most part, they did keep this area clean around the park where the children play, and it's minor debris on the ground. Unfortunately, the 200 block of Rainey Street, they did immediately dump back on the site again. They dumped a large portion close to where the shelter is for the young ladies, and then they, instead of dumping it on the front of the street where it's more visible, they put it behind the trees to the side. So they had somewhat of a conscience in their illegal dumping. And our final cleanup, the 800 block of Mary Street, unfortunately, they did dump right back on that side again. And but with that, we had successes within our project. Overall, the good outweighed the bad. The cleanups were a positive experience for the community and the youth participating in them. We were able to successfully navigate through dangers and challenges to get the job done with a sense of pride. Throughout this rewarding experience, we were able to reduce dump sites and asthma triggers in the community. Only 5 out of the 12 cleanup sites were dumped on again. 12 seniors were helped that called in for help, and community youth were positively engaged in a rewarding experience that fostered empathy and buy-in regarding keeping their community clean. Residents were thankful and appreciative at every site that we cleaned, and we received a lot of positive feedback, testimonials, and requests for us to do it again. So I think that was a win-win for the pilot. The barriers that we had to overcome, despite passing out flyers, some residents still thought some of the youth were criminals doing community service and addressed them in that way. But we encouraged them to foster empathy and to be understanding. Many dumping areas were high crime areas, so we had to be very cautious of our surroundings while working. We had to deal with a lot of people speeding past us while we were cleaning and removing trash. The city requirements regarding where dumpsters could be placed also created some obstacles and challenges in the cleaning. People oftentimes threw trash down while we were cleaning, and then sites that we had cleared out, when we returned the next day, they had been dumped on again. And then the distance between where the dumpsters were required to be placed by the city with what we had to put in them required us to get some assistance from the Chester Stormwater Authority, which provided dump trucks for us to fill and then empty out once they were taken to the dumpster.
This is Dr. Spitt. I want to say briefly, Chester has a bad reputation about being a dirty city, but what we have found is that a lot of the dumping comes from contractors and folks who do not live in the city that come and dump their debris to our community. It's not a lot of the residents dumping this debris, it's outsiders. And so we have a serious problem with that. You know, it's an ongoing problem. And I think it's really important when you do an asthma abatement program and remediation towards trying to reduce the asthma triggers in the families and the children and senior citizen lives, you do not lose focus of the debris that's surrounding these communities. And so I think that this cleanup was really essential, and it will continue to be essential in running a program this magnitude throughout this community.
Thank you, Dr. Strand, for adding that insight. I would also like to say that Additionally, this positive endeavor was contagious. Other community cleanups started happening and occurring throughout the city while we were doing this. And I would also like to say that there was no waste left behind. All dumpster space was fully utilized by the residents. And this just talks about some of the experiences from each site, but I'm not going to go into any detail. I would just like to say that overall, the community cleanups were a positive experience for the participants, the community, and the environment, because we were able to positively impact the environment while fostering an awareness of the asthma triggers that occur as a result of people dumping illegally in the community.
Yeah, I think this wraps up our report, and thank University of Penn for the opportunity to work with this program. And I think everybody can see it was a win-win partnership.
Well, thank you. Thank you so much for that great presentation. I don't know, I feel really inspired by the work and by the spin-off benefits that were more than we expected, actually, I think in a lot of ways. And so I would like to take questions, but I want to also hear some of the analytical work that was done by Courtney Walk. So I'm going to quickly turn it over to Courtney, and then please, if you have questions for either of them at the end, I hope you'll ask them. Thanks.
All right, so I'm going to share with you some of the evaluation efforts that I've been working on along with Suzanne Tham, who is a graduate student in the School of Social Policy and Practice here at Penn. So we have been really interested in understanding sustainment of the cleanups. You just heard about the amazing work that Deetra and Dr. Strand and team have been doing. And so we wanted to take a look at all of the photos of the sites to understand objectively as best we could how well the cleanup efforts were maintained over time, as well as to learn what we can about the impact of the cleanup on residents, leveraging some surveys that are happening through a community health worker program that is happening in Chester. So I'll tell you a little bit more about both of those data sources and what we're seeing so far, but just want to preface it by saying that these data collection are in progress. So at this point, we don't have kind of the full range of photos and surveys that we'll have once we get a little bit further out. So we received from the team all of the photos that were taken at each of the sites. So the team took photos prior to the cleanup, as you saw, immediately after the cleanup, and then at 1 month post cleanup, and additional photos will be taken at 6 months. And what we did was we utilized the grading system established by Keep America Beautiful to rate each site at each time point around the kind of magnitude of litter at each site. I want to just sort of share with you the metrics on the right-hand side, or sort of, this is how the rating system is set up. There's some limitations to it that I want to point out. It's not a perfect instrument. As you can see, it's quite difficult to get a 1 or a 4. So you'll see as I share the results that a lot of clustering in that 2 to 3 range. And additionally, we were relying on photos from the site, and it's hard to sort of sometimes really understand the whole magnitude of everything that's happening in a location by relying on photos. But what we did was we independently looked at the photos at each time point for each site and assigned a rating using this scale. And then we met to resolve discrepancies and arrive at consensus ratings for the photos that we had access to. And what you'll see is that we saw kind of a range of ratings from 2 to 4 at that kind of pre-cleanup time point. All of the sites achieved a 1, which is what we would expect following the cleanup. And I think that's consistent with all the photos that you saw of the amazing work that the teams were doing. And then at the 1 month follow-up point, as Deetra highlighted for you, many of the sites were successful in maintaining a high degree of cleanliness and absence of litter at that 1 month time point. And as she shared, there were some sites where we did see some increase in litter or evidence of dumping. But overall, we were really pleasantly surprised to see the maintenance that many of these sites were able to do. And we'll continue to look at the 6-month photos when they come in so that we can understand a little further out how well some of these gains are maintained. The other source of data that we have access to are surveys. There's a community health worker program in Chester that is supporting families with children with asthma. And as part of that program, the community health workers, when they visit the families at baseline, 3-month and 6 months of their support, the families are completing surveys. And there were 5 questions that were part of those surveys that you can see on the right that we thought would be interesting in understanding kind of the issues that might be happening in the neighborhood related to pests and trash and litter. And so we leveraged the data that we had access to kind of understand what the residents' experiences were like with relation to pests and litter in the neighborhood. At this point, most of the families who are enrolled in that CAP program have completed their baseline and 3-month surveys. But I want to just note that most of those surveys, including those 3-month surveys, were completed before any of these cleanups happened. So this is really sort of baseline data that we have so far that represents people's perceptions of their neighborhood prior to the cleanups occurring. And then there will be an additional 6-month survey time point that will come in relatively soon that will have largely been completed for participants after the cleanups occurred, and will allow us to then make some comparisons from people's perceptions related to the cleanups that happened. So the way we're approaching these survey analyses are to organize participants according to whether or not they live within or outside an immediate radius of a cleanup site. We set that zone as a 0.25 mile radius. There was a little bit of judgment there. We wanted to make sure that we were capturing enough residents who lived in proximity to a site. But if we set that radius too narrowly, then we have very few participants. So I just want to mention that. At this point, we've just conducted descriptive statistics because, as I mentioned, we really only have kind of baseline pre-cleanup data. But once we have 6-month surveys, we plan to also compare ratings between those who live within and outside a cleanup area, as well as ratings from pre to post cleanup among those who live within a cleanup zone. So this is what the map looks like. Those green squares are sites that were cleaned, and the blue dots represent survey participants who have completed surveys for this community health worker program. So I'll just share with you what that baseline data is looking like, just really briefly, and then I'll stop so we have time for any questions. So what you'll see is that most residents are saying that they don't have frequent issues with cockroaches outside of their home, and that the ratings are relatively similar for people who live within or outside a cleanup zone, which we would expect them to be similar since the cleanups hadn't happened yet. People also rated the degree to which they've seen mice outside of their home. Again, people were predominantly rating that as an infrequent phenomenon. In the past month, has garbage removal been a problem in your neighborhood? Most people were saying that that was generally not a big problem for them. And similarly, most people rated litter as not being a problem in their neighborhood. And then we asked people finally how they feel about the environment on their block. And most people were responding in the kind of good kind of mid-range for that survey. So that's what we've been able to look at so far. We're really excited to take a look at that 6-month photos and survey data so that we can really understand a little bit more about sustainment of the cleanup efforts, as well as impact on residents. And then we'll work towards compiling all of this information into a report to share back with everyone involved.
I want to thank all of our presenters But I really want to thank the workers, the people that were involved in actually doing all of this work in both projects, because you can just see how much work that was. It was a huge amount of work, and it was massively important to the people who were immediately impacted. So I feel really proud of the work, and I hope that you all do too. And I thank you so much for your input on it. And we look forward to some of our next round of pilot projects. We have Dr. Okach with us and Dr. Hahn, and they both have pilot projects, translational ones in our next round, and we're really looking forward to hearing from them.